Right, well, more than 200 Cuban medical professionals arrived in South Africa early this morning, and the team will join the fight against coronavirus across the country. But joining me now to talk more about this is Doctor Angelique Coetzee from the South African Medical Association. Doc, thank you so much for your time and welcome to ENCA. Let's talk about particularly the duties and roles of the 200 Cuban doctors that have just landed within the country.
Good evening, good afternoon, and good afternoon to all the viewers out there. Yeah, this is a very interesting development, and they landed 217 Cuban health specialists and workers last night. They have arrived. They will be quarantined in Pretoria, as per my understanding, for the next 2 weeks. Under these health specialists, we had the following people. We have experts in the fields of epidemiology, biostatics, and public health. Also, they have family physicians, which will help to guide interventions through door-to-door testing. These family physicians will also assist local healthcare workers in health promotion and disease surveillance at the community level. On the level of the healthcare technology engineers, they will help and assist in the inventory, deployment and repair of aged medical equipment. And then also they have experts to provide technical assistance working with the local expertise. Then what also happened is that the provinces were asked how many of these Cuban healthcare or brigade of workers coming in would they like to have at their facilities, and nearly all the provinces except Limpopo had indicated that they would like to deploy some of these Cuban brigades expertise that came into the country.
Right. We heard from, the Minister of DIRCO, that's Minister Naledi Pandor, as well as the Cuban ambassador to South Africa, talking about, the landing of the Cuban medical experts and medical doctors, sort of welcoming them as they landed. But, Dr. Angelique, I wanted to know if the decision to bring them was an issue of, a lack of sufficient or enough resources within South Africa. Was it just purely based on expertise that we did not have within South Africa, or because there was a shortage of doctors within South Africa?
Well, this is a very difficult question because we do have these expertise in South Africa. I think maybe the arriving of the Cuban doctors is a bit premature. We haven't worked out all the, all our healthcare persons where we can put them, and how many is unemployed currently that we can maybe roll into this endeavourment to get more doctors and health statistics or statisticians to be able to provide services. The quote for about 187, around about 400 million, is quite a lot of money for a year. So maybe it would have been prudent just to make sure that we first use our local resources before we outsource. But we also understand that President Ramaphosa, reached out to the Cubans and ask them for their help to come and assist us in this time. Again, we still hasn't gone fully into the epidemic, as we are all still waiting to see what's going to happen. So maybe for now we would be able to do with our own local people and resources that we have.
Yeah.
So, but it is what it is.
Well, unfortunately, it is what it is. But, Doc, there are still those unemployed medical staff members that are facing the brunt right now. You mentioned, interestingly, that the budget allocated is around its millions, and there are still unemployed medical staff members, including doctors as well as nurses, who could have been utilized, whose services could have been utilized instead of outsourcing. What happens to them then right now?
Well, so as far as I know, they have not been asked to supply or submit their names into a database all those doctors and nurses that's unemployed. I know that the military ask for people who has been previously working in the military to come back and to provide their services, but I haven't seen such a call yet locally in South Africa from all the national departments of provincial departments of health. I think I might be wrong, but I think KwaZulu-Natal did ask for people to supply names, but not in this capacity. There was not a call that I'm aware of for family physicians or for healthcare statisticians or these engineering type of people that we now are bringing in from overseas.
And just before I let you go, Dr. Angelique, do we know how long the Cuban medical staff will be in South Africa for?
12 months.
For a year. All right. Well, thank you so much. That was Dr. Angelique Coetzee from the South African Medical Association.